half, right? We would see that it's not symmetrical. We look at the borders, they're nice, not nice even borders. They're jaggedy, irregular. The color, is it even in color? No. It's got black, it's got pink, it's got a little bit of brown, and it's large. You know, it's a little bit more than 6 millimeters. Here's another weird one. Look at the borders, the irregulars, everything. So what about melanoma? Sunlight causes melanoma, and sun protection can probably reduce the incidence of melanoma. So we're talking about a disease that's preventable, and if caught early, it's curable. So what about the other one, basal cell carcinoma? That's the most common form of cancer in the United States. It's very, very, very prevalent. We see hundreds of skin cancers in my practice every month of these basal cells and squamous cell. It's very, very, very common. 1 million cases in the U.S. In 2006. It's less aggressive, but it does destroy tissues locally. These are the people that you see walking around with a piece of their ear missing, or a hole on their nose, or the lip part of it gone. These are the ones that can destroy locally. And if they grow in an area, when you have a treatment for those, you have to cut the part of the tumor plus areas around it that are abnormal to leave a good margin of normal tissue. And our friend Liz Taylor has had lots of basal cells. Basal cell, this is an example. They look like a little pearly bump with little blood vessels. Sometimes they bleed. It could be a sore that doesn't heal. And here's another example. Now, squamous cell, what does that look like? They can evolve from something that's called actinic keratosis, which is a precancerous growth, which is just a little red, scaly spot. We normally just freeze them with liquid nitrogen. Very common on the dorsum of the hands, the ears, the face, a lot of the sun-exposed areas. So squamous cells, 25% of the actinic keratosis can become squamous cell carcinomas, and that's why if we catch them when they're very insignificant, we just freeze them with liquid nitrogen and they're gone. 1% metastatic rate. So this one is a little bit more aggressive than the basal cell, but not as aggressive as the melanoma. Anybody recognize these legs? Next. She's had squamous cell carcinoma, and you can see it was quite extensive because it required probably a skin graft. It's a big area there. So a lot of these people, when a celebrity has a skin cancer, then everybody starts getting worried about it. So we should just that not just when somebody of a politician has it, but we just need to create awareness and follow these topics that we've touched on today, because if you see something like this, I see a patient like that, and I said, how long have you had that? Oh, a couple weeks. This has not been there a couple weeks. This has been there months and probably years. So that's what I'm saying. I mean, do not let these things get to this significant, like this one, or this lesion. I mean, why would you let things like that just grow on you? So that is what we are talking about. Next, we're talking about preventing these lesions when they're so small that we can just come in, zap them. These are what the actinic keratoses look like. Little red scaly stuff, and they're frozen, but if you don't do it, then they become the bulky other spots that we looked at in the previous pictures. Now, look at, these are two twins. And this is the difference of what we call intrinsic aging versus extrinsic aging. There's the intrinsic aging is what we're genetically born with. These are the people that come in my office. I hate the wrinkle in my forehead. My mother had it. We all have it, and I don't like it. Those are the things that you can't change, what you are genetically born with in terms of how you're going to age. Now, what you can change, it's the external exposure. This one was out in the sun all her life. That one was never out in the sun. So sun exposure increases the risk of what we call photo damage. And photo damage are wrinkles, mottled pigmentation, brown spots, which some people call them age spots for a reason. They're not really age spots. They're sun spots. They're caused by the sun. So all of that is photo damage, and that is one of the issues that sometimes when we talk to teenagers and they really don't want to listen about skin cancer, you want to tell them about, you want to become a prune sun damage can cause wrinkles, pigmentation, spots, and you can see the difference of somebody that's not taking care of themselves and been out in the sun a lot to somebody that hasn't. Now, which contributes most to skin cancer development and which contributes most to photoaging? I bring this up because we're going to be talking about sun protection and sunscreen. And before, we only used to have UVB sunscreen. And that was what we called a sun protection factor, was a way of measuring the strength of the sunscreen. And the SPF only measures our protection against ultraviolet B. It does not measure our protection against ultraviolet A. So let's look at what is this ultraviolet A and B. Well, ultraviolet B, this is a piece of skin, and we're just cutting a chunk of the skin and looking at it. And you can see it penetrates very superficial, UVB. It does not go very deep. But UVA goes deeper. That's why the tanning booths, a lot of them, they went from UVB because people would get burned and red. And then they said, oh, no, now they're not harmful. We're going to do UVA rays. And look at what the UVA rays are doing. So if we divide, UVB is the one that gives us the sunburn, and it's the one that eventually causes us to tan and skin cancer. But UVA causes an immediate pigment marking. It's more related to a lot of the phototoxic reactions that we have when we're out in the sun and we get a bad sunburn from a medication or a drug, but also premature skin aging, and it probably also has to do with skin cancer. So what has happened now is that we think that both of them contribute to cancer development, probably UVB more than UVA, and probably UVA contributes more to your photoaging than UVB. So the result is that you have to use sun protection for both, for UVA and UVB. Now, how will tanning beds influence skin cancer statistics? Let's look and see what's happened. This is what's happening now, and it's happening local and nationwide. We're having a lot of the teenagers and a lot of the young people, and this happens a lot in the north part of the states where their summers are kind of shorter. So during the winter, they want to look tan. So we're seeing a lot of these young women and men with very abnormal moles in double-covered areas. That means areas that we would not expect them to get them from sun exposure. So they're getting them from sun lamps and from tanning salons. And that's why in some states, a lot of these tanning salons are banned. And from what you learned at the beginning, these are bad-looking moles. They're asymmetrical, they're too dark, and they're brand new, and they're popping in these areas because of the use of tanning salons. So, and you can see here's another one with a lot of